1 in 5 of the world's HIV-infected persons live in South Africa. And like I said, to mark World AIDS Day, Xikundu village in Limpopo is the focus, where Deputy President David Mabuza is set to give a keynote address in his dual role as chairperson of the National AIDS Council. Siphamandla Goge is covering that event for us and joins us live now. It's not every day that Xikundu will receive a visit from the Deputy President and the Minister of Health, but it shows just how important the rural areas are in this fight against HIV.
Indeed, that is the case, and Xikundu village is one of those villages across South Africa and in Limpopo which has got the highest number of people living with HIV and AIDS. And one of the main concerns in this village is the issue of teenage pregnancy. I think in terms of statistics here, the Department of Social Development will correct us, but I think earlier on I overheard the Deputy Minister, Henrietta Zulu, saying, well, in this area you've got a number of young girls between 9 and 14 who are part of the highest number of teenage pregnancy in the area. And that is a concern, of course, but the concern is also the role that men play in these cases. Of course, I mean, if you have girls as young as 9 and 14 being pregnant, that talks about statutory rape. There is no doubt about it. So that is one of the major concerns in this area. And the issue of villages and people from rural areas basically continues to be the main focus, because in terms of access to information and access to services when it comes to HIV and AIDS, they continue to be left behind. That's why we find ourselves here at Xikundu village. On my left, my hard-working colleague Joe Komane will show you the Deputy President of the Republic of South Africa, David Mabuza, who is the chairperson of the South African National AIDS Council, and the Minister of Health, Dr. Joe Pahla, the Premier of the province, Stan Mathabata, meeting with the local chief here. Of course, the role of traditional leaders is very important in defeating the scourge of HIV and AIDS. But right now we are joined by the representative of the World Health Organization in South Africa, Dr. Owen Kaluwa. Doc, thank you very much for your time. First of all, let's talk about the commemoration of the World AIDS Day. Many people are saying we have taken our foot off the pedal in terms of commemorating this and focusing on HIV and AIDS due to COVID-19 pandemic. What will be your take?
So my take is indeed a lot of time has been focused and efforts in responding to COVID-19. Correctly so. But what is important is that we should never take our foot off the pedal as we address other essential health services, including HIV, which is one of the most important diseases or conditions that we have to deal with in most countries, particularly here in South Africa. So even as we respond to COVID, we should respond to all the other essential public health services, taking into account a people-centered approach, because all these conditions, COVID, HIV, diabetes, etc., affect the same people. So if we're looking at improving health of the people and well-being, we should take a holistic approach in addressing the various disease conditions, COVID and others together.
How do we eradicate the ongoing stigma, though? Because many people in rural areas still face the stigma.
You're correct. Stigma is one of the biggest enemies, not only in implementing and promoting various public health intervention, particularly HIV, but others also. Even in COVID, some stigma has also been observed. We have to deal with stigma. We have to end stigma so that we create an enabling environment in which various programs can be implemented free of stigma, so that we really can impact positively on people's health.
Is the 2030 deadline achievable that has been set to deal decisively with HIV and AIDS? Some people are saying it's not going to be achieved.
Yes, but I think the most important thing is let's set our foot firmly on the journey towards that. And that's what we need to do. Be optimistic, deal with the various hurdles, including stigma, which you just mentioned, and move decisively towards it. And then we'll do a lot of benefit. We may not achieve the objective, but in the process we'll save a number of lives, and which is important and which is what our focus should be.
Many countries in Africa, including South Africa, would need to deal with socio-economic challenges, poverty, unemployment, inequality, in order to address the issue of HIV and AIDS somehow.
Yes, that is true, because, poverty, inequality, these are all social determinants of health. Because they impact the extent to which people can access health services, they impact to the extent to which they can be equitable health services. Unless there is equity in health, we are not going to reach the goals of universal health coverage, where everyone can have access to the health service they need without even falling into financial difficulties. We have to address inequities, because the last mile of achieving objective will be so difficult if we don't address inequities, or whether it be economic or whether be it geographical, because certain places cannot be reached, but we have to reach. And in the spirit of SDGs, as you know, leave no one behind, and that is a central issue of ensuring equalities.
You represent the World Health Organization in South Africa. There are issues in terms of the new variant that has been detected. There are reports that the European countries detected the new variant days ago, but it was not reported. What do you think of the world's reaction to South Africa following the detection of the new variant?
South Africa has done tremendous, very good work. This is the work in terms of the genomic sequences and the surveillance for new variants, and being able to identify new variants and report on them very early is critical, because it determines the speed at which we can respond to it, and therefore minimizes its impact, that we can understand what we're dealing with and have the rightful and correct intervention. So what South Africa did is highly commended, and has been commended by different forums globally. But the reaction has also been seen to be punitive and to be rash and not to be based entirely on science. And that has been the concern, because we should reward good work. We should not punish good work. So at the moment, there are interventions that have already been implemented in terms of ensuring that international travel is safe. The question of ensuring people have got a negative PCR before they travel. The issue of vaccination. All these have been implemented and have been working. So it is critical that we sustain this scientifically proven intervention other than have blanket bans.
Doc, thank you very much for your time.
Thank you.
That is Dr. Owen Kalua, who represents the World Health Organization in South Africa, as the World Health Organization is part of commemorating the World AIDS Day.
Siphamandla Goge, thank you. He's out in Xikundu village, where the Deputy President will be delivering a keynote address.